Hi, I'm Dr. Malcolm Franklin. I'm a primary care physician with Dooley Health and Care, and I would like to take a little time this afternoon to speak to you about adolescent depression. Many of us have heard the term depression, but aren't really certain as to what it means from a medical or a clinical standpoint. Depression is a serious mental health problem characterized by pervasive sadness and a loss of interest in activities. Depression is a disorder that makes a person sad, but it's far more than normal sadness. Normal sadness can be relieved by a change in circumstance. Clinical depression can't be changed so easily. Depression can make it hard for a child or a teen to enjoy normal activities, to perform well in school. It can make it difficult for them to relate to their family, their friends, and their teachers. It can cause them issues in their extracurricular activities. Depression, unfortunately, is often thought of as an adult-only problem. The sad reality is that many children, especially teenagers, struggle with clinical depression. Because we in healthcare tend to think of depression as an adult problem, the pediatrician or family physician may not be considering depression when they examine or interview a child who's coming in with some of those symptoms. The trouble here is that growing from a child into an adult, going through that period of adolescence, brings about its own challenges, and it can make people feel more self-conscious. It can make people more sensitive and more emotionally fragile. But depression is different than that normal experience that we all go through as adolescents. Depression can affect how a person thinks, how that person feels, and ultimately how they behave. Depression is diagnosed when there is at least 2 weeks of a depressed mood and at least 5 of the following symptoms: loss of energy, change in appetite, where a person either eats less or more food than usual, or when a person loses weight unexpectedly or gains weight unexpectedly, a loss of interest, guilt, poor concentration, mental slowing. Thoughts of death or suicide are often seen in patients with clinical depression. Symptoms of depression can be emotional and behavioral. The emotional symptoms that are most often seen in patients who are depressed are sadness. Patients may tend to cry without an obvious cause, frustration, anger. People can become easily irritated or annoyed. People can begin to start arguments with friends and family. People can have a loss of interest, become socially withdrawn. There can be an extreme sensitivity to rejection and failure. There can be a persistent thought process or rumination on previous failures or previous shortcomings. People with depression tend to have difficulty concentrating and very difficult time trying to remember information in school. There can be a grim outlook on life or on the future when a person is dealing with clinical depression. Some behavioral symptoms that are seen in patients who are clinically depressed: they may sleep more or less than usual. They may complain of being tired and have low energy. They can become easily agitated. They can have a sense of restlessness where they're constantly moving or fidgeting. This can often be mistaken for attention deficit disorder. Physical complaints such as persistent body aches or headaches. Some children and adolescents complain of stomach aches. They may have more frequent visits with the school nurse. Social isolation is something that is experienced by people who are clinically depressed. A loss of concern with personal appearance or personal hygiene is characteristic of a depressed teenager. Poor school performance with increased number of absences from school, and ultimately experimenting with drugs and alcohol can be seen in teenagers who are dealing with depression. What are some causes of depression? Well, chemicals in the brain, known as neurotransmitters, are thought to be the largest cause of depression. Uh, Chemicals such as serotonin, when there are smaller amounts of serotonin in the brain, that can make people more susceptible to depression, along with other health issues, mental health issues. Some people may be more likely to have depression if it runs in their family. Certain medical conditions can lead to depression, such as an underactive thyroid gland, low vitamin D, low testosterone levels, other hormonal irregularities that young women can have. A history of early childhood trauma can be a cause of depression later. So children who have experienced physical or emotional abuse, a past history of family stressors, such as the death of a parent or divorce of parents, can play very heavily into leading to clinical depression based on the coping mechanisms of the child or adolescent who's undergone that family trauma. Risk factors for depression are having a low self-esteem, children who struggle with obesity, victims of bullying, relational problems with friends or family can be risk factors that lead to clinical depression. Children who have poor coping mechanisms to difficult situations are more prone to clinical depression. Children with learning disabilities, children who do struggle with attention deficit disorder and ADHD, and children who already use alcohol, nicotine, or illicit drugs are more likely to experience clinical depression. Clinical depression is a very important diagnosis to be considered by family members and health professionals so that it can be identified and treated early. Depression that is not treated can lead to very serious consequences, the worst of which could be a greater risk of suicide. When a family member suspects that their teenager may be struggling with clinical depression, it's important to notify the pediatrician or the family physician. The doctor and his staff will typically need to meet with that individual to ask questions, to do a physical examination, and perhaps to even run some blood tests to rule out physical diseases like thyroid or other conditions that could lead to depression as a secondary issue. Then it's important to figure out a treatment plan once the diagnosis is made. Many patients who have clinical depression require treatment in a variety of forms. One very valuable form of treatment comes in the form of psychotherapy. That's when a patient meets with a psychologist or a counselor or even a psychiatrist to discuss how he or she is feeling and better ways of coping with those feelings. Another modality is adding medication. So there are several medications that have been utilized over the years for treating clinical depression, and they can be initiated with good success in adolescents and children who deal with depression. Adolescents who are depressed and need medication will need to understand that the process can take a while before the full manifestation of the treatment is experienced. It could take 4 to 6 weeks for a lot of patients to finally feel more like themselves once they've started medication. It's also important to know that not every medication may work on the first try. So when a person is depressed, it is very discouraging when you take medicine and you don't start to feel more like yourself. So it's important for healthcare professionals to manage that expectation. That allows patients to know that this is going to be a process and we may not hit the nail on the head with this first treatment, but we're going to listen to how you are feeling, how you are responding, and we'll be willing to change and alter the therapy as time goes on and as the situation dictates. It's important for patients and for family members to recognize signs of worsening depression and signs of severe depression, which are usually characterized by a pervasive sense of worthlessness, hopelessness, and despair that causes the patient to ruminate on death or even harming themselves. In some cases, people may even threaten to harm others when they're so severely depressed. In those instances, it's important to seek emergent medical care, generally calling 911 or trying to get that family member to an emergency room where they can be treated more aggressively. I hope that this information has helped to shed some light on clinical depression, on what it is, and the fact that young people, children and adolescents, need to be considered in struggling with depression. There are many valuable resources for families and for patients struggling with depression, and we hope that those resources are made known to families so that they will know that they're not in it alone when a situation like this arises. Take care and thank you.